observe for primes, which is pain, rash, injection marks, injury, medical alert tags, medication patches, edema, and scarring. And I'm just visualizing for that first. And do I find anything? Oh. And I'm gonna look on the face. I'm gonna check the pupils to see if they're equal, round, reactive to light. Yep. Checking his skin color, temperature, condition. And he's unconscious right now, so I can't check for facial droop. Give a little touch here to make sure there's no injury. Palpating for tenderness, instability, and crepitus. Don't find anything, so I'm gonna move down into the neck. Again, looking for primes. Additionally, looking for accessory muscle use, JVD, to see if the trachea is midline. It all is. And do I feel anything? Nope. I'm gonna observe the chest. Again, now I'm going to observe for Simba rip, which is scars, implanted devices, medical alert tags, medication patches, barrel chestedness, accessory muscle use, rash, injection mark, injury, pain, or paradoxical motions. Visualizing to the best of my ability. And again, palpating, see if I can feel anything. Auscultate his lung sounds, the apices and the bases. Good, and so we're just noting to see if they're clear, equal, or if you hear anything in there. And now move down onto the abdomen, again observing for Simba rip, except for this time, instead of barrel chestedness, you'll look for bowel sounds, and instead of paradoxical motions, you'll look for pulsating masses. And you want to palpate for any distension, rigidity, and tenderness in all 4 quadrants. Nothing noted. Moving down into the pelvis, again, you're going to be looking for primes. And looking, feeling if it's stable, down and in. Nothing. Looking to see if there's any incontinence, discharge, or bleeding. Noted. Looking for primes again, down into the legs. Visualize. Noted. And feeling for CMS, which is circulation, motor function, and sensory. And if he was conscious, you would get him to pull his toes to his nose and push down and make sure you can feel his toes. And make sure that his pulses down here are equal and strong bilaterally. And moving up here, upper extremities, again observing for primes. Visualize and palpate down. Good. And checking CMS again, so circulation, making sure pulse is equal bilaterally, strong, regular. And get them to squeeze for motor and circulation, or rather sensation. And then I want to flip over to the back. Again, observing for primes. I'm going to visualize the entire back. See if I note anything. No. Give a quick feel down as well.